So now we're going to hear from another launch site, the Hunter launch site in New South Wales. So please welcome Mark Cliff from RichmondPRA.
Hey everyone. So it's this button here. Okay, so which one my wife was here at the moment. She has to do more than one thing at a time. So look, I am mindful that I'm going to get signals, so I don't want to take up too much time with certain things. So I'm just going to skip through a few slideshows. That's just a little bit out. But I'm going to say that because there was a comment mentioned earlier on about that the scheme will work for large organisations. I'm a bit nervous, but I'll get through that. So RichmondPRA is a very large organisation, and we were at the beginning of the launch back, I think it was June last year. And I'm quite grateful that we actually had that opportunity, because you can see by the size of the scope of the organisation that we need plenty of time to get ourselves ready for it. And if we're not ready for it, well then obviously there potentially could be some risks for us as well. I would also like to acknowledge the traditional owners of the land that we meet today, and pay my respects to their past, elders past and present, as well as extend that to any Aboriginal people who are with us today and tomorrow. I just wanted to start off by saying that our experience has been very positive. That doesn't mean that there's challenges, it doesn't mean that there's concerns, but it's been very positive. And I'd like to also say that the agency that we're fortunate to work with have been fantastic. And you know, whilst it was a bit rough at the start, they're very welcoming to listen to our concerns and work with us around making sure that we get it right for the people that we're all trying to get it right for. It's a little bit about us. So I'm going to start off with this is Gav. Well, it's not really Gav, but when I see this picture, it reminds me of Gav. So Gav's a gentleman that he's utilised our service for about 14 or 15 years. I've known him for some time. Wonderful bloke. Originally was part of the 24-hour, what they used to call group home. But now lives, and when I say now, this is not because of NDIS, sorry, it's because of Gav. But now lives out in the community by himself. We hardly see him, he hardly sees us, and that's the way he likes it. He was part of where he really had limited choice around the traditional providers, so he'd have a day program, and then he had us providing support in his home, and that was really about it. Wasn't much flexibility. Day program finished at 5 o'clock in the afternoon. We had lots of other people that we had to support, so it was really about just stuff that you do in the home. Loves fishing. He likes building stuff, and he used to do all that sort of stuff in groups. So anyway, he was one of the first people that was fortunate enough to get some funding through NDIS. And what that means for him is that he's got a circle of providers now, not just your traditional providers. He's got a circle of providers. His support doesn't stop at 5 o'clock in the afternoon. He can do, in actual fact, the other day he rang me and he said, Mark, he said, I need your advice on something. I said, what's that? He goes, I don't want you guys coming at the night time. I want to be able to do something with this provider that can take me out and go to the movies and do that sort of stuff. Is that okay? I said, is that what you want? He said, yes. I said, then it's okay. You do that. He's able to go to the man shed where he can do lots of blokey bloke stuff. He's a real blokey bloke. Gav's 45 years of age, by the way. He's not a kid. He's a man. And he's able now to do stuff when he still does the fishing, but he doesn't do it with groups. He does it, with a worker, and he likes that. I thought I'd throw this in. This is about us. We're in 3 different LGAs. We're in Newcastle, Macquarie, and Maitland. Maitland is yet to phase over. And Macquarie, we're scheduled to phase over in Q4, which you can see is April and June 2015. And Newcastle, well, we've already phased over. We're meant to phase over in Q4, April, June 2014, but we actually phased over in January to March 2014 at short notice. So it was a bit of a panic for us because we thought we had plenty of time. My message to you is that expect the unexpected, okay? You don't have plenty of time, it's just around the corner. And it's great to see that there's people here who want to know a little bit more about how it can work for you, but more importantly, how it can work for the people that you know, are using our services. So I've decided to break this down into 3 categories, you know, what's worked and what's working, what challenges, because like I said, you know, just because it's been a positive experience, we still have some concerns and we still believe that there's lots of things that the scheme needs to change to make it work for people with psychosocial disability, as well as people with disability. I'm, like I said, fortunate to be involved in a disability network in the Hunter. So I get to see both sectors and how it's impacting on them. And the scheme, whilst it's not perfect for people with psychosocial disability, it's also not perfect for people with other forms of disability as well. And I think the agency is aware of that and they're actively working towards making sure that they can make the appropriate changes for that. So we're quite grateful that they listen to what our concerns are. So I've broken it down to RichmondPRA's top 5, and then also the person's top 5. The person's top 5 comes from conversations that I've actually had with people, but it's also from my own observations as well. So I've got a little bit of a guide here. I should probably refer to it because someone's get lost. And it's not as neat as what that looks like. It's just, as I'm hearing people talk, I'm scribbling things down and it's just a mess, so bear with me. So the phasing period. That worked really well for us, even though, you know, the start was a bit hectic. We took the organisation decided to employ 1 person, that was me, to really focus on supporting the people that were existing in our service that were phasing over, and that was our goal, to make sure that worked for those people, and that process allowed us to advocate for them, work with them as well as the agency around ensuring that the supports, because I think it was mentioned earlier on that, you know, they were promised that no one would miss out, and we rolled with that, and we worked with the agency to make sure that those people wouldn't miss out. Initially the agency was a bit resistant, didn't really want to listen to what we had to say, but like I said, over the past 16 months, you know, we're working together and that's working really well. So the phasing period, focusing on what the person needed, understanding what the scheme was all about. I made a comment earlier on, and I hope I don't offend anyone when I say this, but we're almost 2 years into it, and I still hear people say, you know, NDIS, NDIA, whatever it's called. You know, I think we need to know what it's called. If we don't know what it's called, then how do we move forward? We need to understand it. And that doesn't mean that it's perfect, but we need to understand it. I've thrown in their meetings. We have lots of meetings. I meet with my CEO, Pam Rutledge. I meet with Phil Naden. I meet with staff. I meet with managers. I meet with NDIA. I go to their forums. I meet with other providers. I know there's a concern that, you know, we talk about having a market. Well, that's the case, but I've found it really important to maintain some of those really key partnerships, and we share experiences and we talk, and we don't hide anything, and that's helped us get through that. The claims process, a few of these grey hairs have come from that, but that's okay. It's something that we need to do, and we need to understand, and we've dedicated a lot of time into understanding how that works, looking at what systems we might need to put in place. Fortunately for us, you know, we had a lot of those systems already, and we're now looking at how we can make those more effective. But look, admittedly there's a lot of time put into it, but that process is working quite well for us because we understand it, we talk about it, we meet often, and we share experiences. providing person-led support. I know the agency uses the word person-centred. We tend to like person-led because that way the person's actually at the front, not in the middle. And we're finding that whilst it's something that we've tried to do, and I think that we have done in the past, I think this has given us an opportunity to look at how we can do it better. And fortunately for a lot of the people that we support, they're getting the funds that allows them to I guess, employ someone to provide that support. And if we can't do it, well then looking at who can do it, looking at maybe an alternative provider who can do that. And like I said, partnerships, you know, we've got people can support those people around social activities and, you know, having fun and doing that sort of stuff. So we're looking at how we can broaden that so that the people that we support, you know, have more options. So the person's top five, and like I said, this is based on some discussions with people, but also observation. The planning process for some has been quite, you know, has worked well for them. It's given them an opportunity to reflect on what they actually do need. You know, this is the first time that they've really maybe had to sit down and really think about what is it that I need, and not for us to tell them what they need, but for them to have a really good understanding of what it is that they need. Provider options. You know, Gav's story where traditionally he had two, and now he's got 3, 4, 5, and he can make those choices. On, you know, I've got a story of one of the gentlemen who we've supported for 14 years. He's a lovely bloke. And we worked very well together. And he came to me at the start of the trial, and he said, "Mark," he goes, "you guys have been great to me. You really have." He goes, "But I want to go somewhere else." You know, and for me that's great. Like that's great that he could do that, and he did that. He went to another provider, and that's going really well for him, and that's okay. And that was no reflection on us, and it was no reflection on you know what he'd achieved. He just wanted to go and try something new, be with someone different. And like I said, all reports, that's going really well for him. Support options. Again, you know, looking at Gav, you know, the people are getting an opportunity to do things that they've never done before. They can be creative about what, you know, and I know that people might say, well, why hasn't that happened before? Well, I guess the reason why it hasn't happened before is because, using Gav as an example, he only ever had 2 providers. Now he's got more providers, which gives more support options. He can be creative and he can look at what it is that he wants to do, and then if we can't provide it, he can go to someone who can. So he finds that he gets a lot of satisfaction and comfort knowing that that's available for him now. So waiting time for support. So, you know, on reflection, we used to have quite a long waiting list because there wasn't much support or, you know, beds out there for people or vacancies for support. What we're finding now is that, you know, it's not about whether we've got a vacancy, it's just about whether we can provide the support. The people come to us and they go, "This is what I'm funded for, can you provide the support?" And if we can't provide the support, they'll go somewhere else. When it first came over, there was a young lady she rang me up and she said, "My husband's just received some funding. Never had funding before, never had support before. He's got this funding for some support. You know, is this something that you guys do?" And I said, "Yes." She said, "Okay, can you come out and meet my husband?" You know, I said, "Okay, no worries." So I went out and met the husband, and he sat there and we went through everything. And to be honest with you, for that half an hour, I felt like I was a salesperson. Here I am trying to do a sales pitch on this is what we can offer you. You know, and at the end of it, he shook my hand and he said, "Look, thank you for your time." He says, "But I'll be honest with you." He said, "I've already seen a couple of providers so far, and I'm meeting with a few more in the next couple of days, so I'll get back to you." And that's fantastic. That's, you know, that was great. You know, and anyway, we didn't get a job, but, you know, maybe it was my sales experience. Maybe I need to learn more about that. So, and choice and control. Look, I mean, I guess it speaks for itself. And I want to say that some of the things that I'm putting in as working well, they do cross over as well to some challenges, because choice and control, whilst it sounds fantastic, you know, in the challenges, there's some people that don't actually know what that means. They've never had that. And you know what? They may never embrace that. And that's a challenge, because if we really want this to work, if we if the concept of it is choice and control, when that person goes to that planning, they're the ones that should be making that decision. And if they can't do that, well then, you know, does that really fit for them? So challenges. We're finding culture shift a bit of a challenge. And I don't think it's about staff understanding that, you know, this is about people having choice and control. I think it's about understanding that we need to do things differently. You know, as an organisation, you know, I think it was mentioned earlier on about unbillable hours. There's lots of unbillable hours, unbillable support, and it's something that we need to really focus on. And I think for me, unbillable support, and when I look at a lot of the unbillable support that we do, if we can get rid of that, for me what that means is increased face-to-face time with the people that we're supporting. And that's what we need to look at. Quoting. Well, I said that the claims process gave me some of these grey hairs, well, quoting gave me the rest of them. I'm only actually 18 now, I'm not really. So the quoting process is it's scary because I've never had to do it before. It's scary because the managers have never had to do that before. We don't know what we're doing. We've had 2 plans approved, so I think I don't know how we got those approved, but we got them approved. It was a fluke, I guess. But the first one got declined, and I think about 3 months later it got approved, and there was 3 months there where I didn't get paid at all. And I guess for a large organisation, we're able to absorb that, and that's a serious concern for smaller organisations. That you know, if you don't get a quote approved, that you know you have to wait before you have to wait for that quote to be approved before you get paid. You know, I do understand that there's been some changes to that, where and the reason why this occurred is because the person's plan would end, and once that person's plan ended, you weren't able to claim against that. It's finished. What's happened since then is that the agency acknowledged that and they moved that money forward. So basically, it will continue to be accessible, and you're able to claim against it until the quote's approved. They're meant to give you 8 weeks' notice, and that's not always happening. So whilst I appreciate that the agency is acknowledging that and doing that, it's still something that you need to be mindful of. And I think that knowing when the person's plan ends is really important to capture that, so that you guys, as a you know, running a business, that you know how to manage that, because that does become our responsibility and not the agencies and not the persons. The plan review process, well, that just sort of links into what I was talking about. You know, that they're not giving us enough notice doesn't allow us to provide a quote, and that was one of the challenges that we faced, and I guess you know we continue to face. Portal access. I'd imagine those laughs are from people who probably had to try and get portal access. It was a challenge. I guess navigating the portal is I find it quite easy. I don't think that there's anything complicated about it, but the challenge is, you know, identifying which staff member you want to have access of the portal, and then getting them access to the portal. And then when they've got access to the portal and then they lose access to the portal, getting access to the portal again. And it does take a lot of time, and I think that whilst it's not as bad as what it was before, there's still, every now and then it rears its ugly head, and you know, at the moment I'm the only person who sort of manages that, and whilst that's okay for the hunter, you know, without going back to that slide, you see where we are across New South Wales and Queensland. I think the organisation needs to think about maybe giving me someone to help out with all of that sort of stuff. And admin support re-eligibility, we have a lot of people who go to our day-to-day living program, which is, I guess, very similar to FAMS. We only ever see them when they come to that particular centre, and supporting them to actually understand the scheme and then go through the process of completing My Access Checker or other forms that may be required takes up a lot of time, which again we call unbillable hours. We don't get paid for that. Although I do understand that they're looking at an establishment fee, helping people where they can get started around that sort of stuff, and then acknowledging the work that the organisation puts in around supporting those people to become eligible or to at least apply. So yeah, the amount of time that's put in supporting those people, and then also following up, because like I said, we very rarely get to see them. So when they do come back in, it's, you know, have you completed this, or how did that go? Do you need any more support? So it takes away some of the time that the staff members there are using to support other people. So moving over to the person's top 5 of challenges, and again, some of this crosses over to what's working, because remember, everyone's different. The eligibility process. So again, having to fill out those forms, and then from there being told, look, I need. And it was interesting that I think it was Nick mentioned that you actually don't need evidence or a diagnosis just to become eligible. Where what we're experiencing is there's quite a number of people who are having to go back and having to provide some evidence. And on a few occasions, they're either choosing not to follow that process, becoming quite anxious, distressed, and again, staff have to go back and say, have you completed that process? Oh no, I've got to go back to the doctor, I've got to get this, or, do you need some help? Oh, look, I'm not going to worry about it. So that's a bit of a concern, because there's lots of people out there who are having to tell their story again and again. So the planning process, again, it's about, I've known Gav for 14 years, and it wasn't the very first day that he was able to tell me everything that he wants or that he needs. It's taken a long time for us to work together. So having to go along to a meeting to meet someone for the very first time and tell them everything that they need to know, so that they can, put in place a plan that will address your needs and your hopes, your goals, your dreams, your aspirations is for some people quite challenging. And there's a lot of anxiety around that, and they don't necessarily always understand that process as well. But culture shift. The review process is, again, whilst I can say, we need to have that 8 weeks notification so we can prepare a quote, the person needs that notification because they need to plan for that review. They need to be able to reflect on those last 12 months. They need to be able to discuss what they've achieved. They need to be able to discuss what else that they might need. And on occasions, we've been given 2 or 3 days notice instead of 8 weeks notice. Culture shift. This refers to some of the challenges around, I would imagine that when I say this word, there'll be a few little giggles as well. Transport. Traditionally, we've got people who've always had access to that transport because we're able to provide, we could support them to go to the shops or to go to the doctors or whatever it might be. Now we're having to look at, well, in actual fact, we need to work with you, and there's nothing wrong with that, but we need to work with you now about how you can do that yourself, because unfortunately, you're not receiving any funds for that because, and I hate this word, I really do, and I think that if there's one thing that should be reviewed, it's the word what's reasonable and necessary. It doesn't sit well with me, because what's reasonable and necessary looks very different, can be interpreted in different ways, and someone with psychosocial disability, what's reasonable and necessary when it comes to a phone call is very, and I use that as an example because when Gav went through the process, we actually put in part of his support was a phone call in the morning around medication support, and we put down 30 minutes, and we got questioned on that, seriously, does it take you 30 minutes to ring someone up and say you have medication? I said, well, in actual fact, it's not just about the medication, it's a lot more than that. So that was reasonable and necessary. I've been given the 5-minute mark, so I apologise for rushing through, but and maximising choice and control, we talked about that some people have never, they don't even know what that means. So whilst it's great to think, you got choice and control, but if you don't know what that is and you've never had that opportunity to sort of have that, they find that quite difficult. Some of these people are saying, I don't know what that means. I need help with that. So just some of the opportunities, and I've got RichmondPRA, but then I realised, really, they're my own thoughts. They're not necessarily RichmondPRA's, but what we're seeing is opportunities for growth. You know, we're getting people come to us and saying, can you provide some support? I guess the challenge to that is whether we can or can't do that, given, you know, what sort of staffing and resources that we have. It's an opportunity for us to be creative about how we're going to provide some support. You know, we can start thinking differently, doing things differently. We don't have to do things the way that, you know, we've been told we have to do them. Connecting with the community, great opportunity to, you know, when we talk about partnerships and traditional partnerships, we can, you know, look, the partnership should start with the person. You know, it really should, and it shouldn't be just with, you know, mental health teams, and it should be the person, their family, their carers, and, you know, the local community. We talk about, you know, the importance of community when it comes to this scheme. It's an opportunity for us to connect with the community and really work with them so that we can work together to make this work as well for the people. Referral paths, you know, mum, dad, brother, sister, the person themselves. Referral paths are very different than what they used to be. You know, anyone can actually come to your organisation and say, can you provide this support? And then it's up to us to say whether we can or can't. One-on-one, so it's just about opportunity to increase that one-on-one time with people. There are challenges with that, I recognise that. You know, you can't just do it, you need to have resources to do it, but, you know, we need to start thinking about that. How do we make that work? That's our responsibility. Person's top 5, you know, again, one-on-one support. They talked about the option, you know, they're starting to see a bit more one-on-one time with, you know, Gav. Instead of fishing in a group, you can go fishing with just him and one other person. Having more control over my life, being a bit more independent, doing stuff that I want to do, and inclusion. So actually, you know, going to the men's shed and not just staying with your traditional providers, having the opportunity to actually go out and be a part of mainstream services, and not just stuck with, you know, what we've always sort of provided. Just going through real quickly, and this is just quickly, this is Maddie, and it's not Maddie, but I just thought this picture sort of stands her out. She's a 17-year-old young girl, blind, has anxiety and severe depression, and has never had access to any services. And she, her mum and dad actually work in the disability sector, but felt that after they received the funding through NDIA, that a mental health provider would be more suited for her needs. And now, whilst one of the challenges that she sort of faced was going out in the community with you know, the support that's really specific to her needs, she's now accessing the community. It's taking time for her, but she'll get there. And she's able to make some friends through TAFE. She's starting to go to TAFE, and that's with support, but still something that wasn't made available for her prior to NDIS, and it's now an opportunity for her to be able to do the things that she wants to do. I've probably missed a heap, and looking at all the scribble here, I know that I've missed a heap. So look, I'm more than happy to you know, if people have questions later on, they can come and ask me, and I can share a bit more of our experience. So thank you.